So, good morning, everybody. I'm Susann Roth. I'm currently with the Asian Development Bank. I'm very happy to be here, and I welcome all of you. My path hasn't been straightforward, as many of yours too. My background is actually, I'm a medical doctor. I studied in the US and in Germany, and I did a residency in general surgery and emergency medicine in Germany. And at that time, I was one of those victims who had to introduce a new hospital information system. And being one of the juniors, we were the ones who had to input all that data. So that was my first kind of life experience with IT, and I thought, well, there are many things we can optimize, and I could spend more time with my patients and less on data and IT. And then I moved to the Philippines, and I was working there in private and in public sector. And I was in a barangay, which is a community health office, tallying at the end of the month the number of respiratory diseases and so on, how many antibiotics were given. And I know that when you sit there at the end of the month, you don't care anymore if these were 100 or 120 and how many crosses you make. So at that time, I thought, well, there should be also much easier ways to do that, not even talking about finding medical records which were handwritten and I couldn't read that, different languages and so on. So from that time on, I got interested in IT and health. And today what I'd like to do is I'd like to take you on a journey and talk a bit about the Asian Development Bank and why we believe investing in the digital health is really necessary in Asia and the Pacific and why it's necessary now. Then I will give you a quick overview over digital health from the government perspectives and where countries are. And then I will talk about 3 paradigm shifts which we think are necessary to bring digital health and standards to the next level in Asia Pacific. And I like to quote a quite well-known Japanese businessman who said, without standards, there can't be any improvement. And that's what we also believe here in Asia. So who of you is familiar with the Asian Development Bank? Okay, one only. Oh, that's 2. Fazila, of course. Dr. Fazila is my friend and mentor in digital health. So the Asian Development Bank is a development bank, and it's based in Manila. We have around 64 member countries, and we have total operations around $17 billion a year in lending. But our focus is infrastructure. 80% is in infrastructure. And over the past years, we were able to revive and bring back the focus of our management on the health sector. And I've wrote the new strategy for the bank on health. And in this new strategy, we have digital health as one of the investments. If we look at the ratio, 2016, we had around 350 million annual approvals of loans, grants, also in the private sector, for health. And it's still a very small share if you compare it to your 17 billion. But to give you a bit of background on on ADB's involvement in digital health, we joined the Asia e-health information network, and I'm sure you're all familiar with that. Dr. Fazila and Dr. Bonjay will talk about it later a bit more. And we were trying to look at digital health from an investment perspective. And I'll tell a bit more about it later. In 2016, we invested in the Standards and Interoperability Lab Asia, called SILA, we'll also hear about it a bit more, which aims to become a conformity assessment center in Asia and the Pacific. And this year we are focusing on developing costing tools, developing an investment case, and developing a health IT governance framework for Asia and the Pacific and for the countries. Because what we feel is when we approach countries, when countries approach us to invest in digital health, often we have an issue of governance. Different ministries and agencies don't talk to each other. We have an issue of lack of standards. But let me give you a few examples of what we are doing currently. So in Asia and the Pacific, we are currently investing in countries through our health sector loans and grants. And these countries are Bhutan, Cambodia, Papua New Guinea, Samoa, Sri Lanka, Tonga, Uzbekistan, and Vietnam. And to mention here, for example, Uzbekistan, which might be quite surprising for you. Uzbekistan approached us last year to borrow $80 million to build a health information exchange, standard-based, interoperable, national electronic health records. Unfortunately, we had a change in government, so it fell, it fell through, but we're still hoping that this will come back. If we look now at the region, and we look from the perspective of interoperability and standards, let's start with one of the larger countries, India. And what we see in India is very exciting. India set up the National E-Health Authority a couple of years ago, and they're trying to steer standards in India to create an health records repository, health information exchange. You can imagine what a challenge that is with a large population in the different states and local governments. But what we see is India is moving into this direction. I'm very excited about Vietnam. What we see in Vietnam is that the Ministry of Health created an IT division, which is now responsible for the entire ministry, and they're trying to work closely with their local IT industry, Vitel, to develop a standards-based interoperable information system, information exchange. They're looking at the policies, the governance structure, so lots of progress happening there. In Cambodia, Cambodia is a country where a lot of the information systems, also the hospital information systems, were donor-driven. And this seems to become a challenge now in Cambodia as the government is taking over those and also needs a clear governance framework to ensure that whatever they do is standards-based. Philippines is always also a best practice example, similar to Malaysia. I didn't bring Malaysia because I knew Fazila would be here as we are talking about it. In the Philippines, the government made great progress on governance, creating a digital health or e-health steering committee, and now they're trying to develop through the Standards and Interoperability Lab in the Philippines to develop an interoperability framework based on open HIE and drive a standards-based health information exchange. Indonesia pretty much is on the same pathway, and basically we can summarize what's happening in Asia here in four issues, and that is that we see that information systems are still highly fragmented. There's still very little emphasis on funding digital health or e-health in ministries. We see very fragmented activities in the private sector. There is a lack of standards, and we know that even in the private sector, and unfortunately still a lack of regulation. But what we also do see is that the time is right, and the time for HIE is also right now in Asia, because we have a few drivers. And one of those drivers is the increasing expansion of national health insurance schemes as part of universal health coverage. Countries are struggling with exploding health costs, so they need to look at efficiencies, improvements in the care process. And obviously, we are really facing the non-communicable disease epidemic in Asia, which calls for continuum of care and patient-centered care, for what obviously you need electronic medical record. And again, these need to be standards-based. The constraints are still that health IT is not an investment priority. It's still not very sexy. If you talk to governments, they would rather buy medicine or buy equipment for health facilities than to invest in health IT. And one reason might be that we don't really have yet a good investment case. We have to learn from developed countries and see how have they actually monetized the cost of investing in digital health. So what do we need? We need 3 paradigm shifts, and one is in health IT governance. And the Asian Development Bank, together with the Asia e-Health Information Network, is now developing a health IT governance framework for the region, which can then be customized for each country. What we also need is improved public-private collaboration, and obviously we need a good investment case and investments in digital health. Let's talk about the first paradigm shift, and that is health IT governance. So currently, and that's why we are all here and why we need IHE to drive the process also in Asia, is we need to plug into the global process of strategies, blueprints, standards, IHE obviously as our guiding organization, and we need to customize that to the regional level. And there, what is important for Asian countries, where often we are resource constrained, is that we need to have best of the rest solutions, and we need to have clear guidance to countries what kind of standards are the most important ones. Because what we see is often, vendors come to ministries of health and there's very little capacity then also to make the right decisions. And then obviously we have to adapt it to the country level. So we call it kind of IHE guided process at the country level. And for that, what we are developing right now, and actually we have a workshop this week in Singapore with various ministries of health, is a health IT governance framework similar to other IT frameworks from other industries. And if you come from Australia or Canada or so, you have these frameworks already, but they do not exist in the developing countries in Asia. And all of this obviously has to be underpinned by standards. So what we mean with a guided process is that if we have a certain architecture in countries, and let's assume it's open HIE, we need to give clear advice to countries what kind of standards are the right ones and the important ones for them. The next paradigm shift is public-private collaboration. And there, what we see is often, and we are part of this as the Asian Development Bank, when we, for example, look at bidding documents. Right now I was looking at one for Samoa and now for Tonga, where, maybe WHO or other organizations help with these bidding documents. They're not really owned by the ministries of health. Vendors win these contracts, and no one is really there to give good guidance on what is necessary, what is the minimum best, or what's the best standards they need. So what we see is ministries of health are approached by vendors. Often they get sold fragmented solutions, and then they have local developers to somehow make it work. But it doesn't really seem like a coordinated process or a collaboration. And what we are trying to do now in Asia is, through the Standards and Interoperability Lab Asia, to create a collaborative process and to bring these different stakeholders together. And as we heard from Mr. McCoy, it is really what is necessary, bringing these stakeholders together and identify what is necessary, what is best, what standards to use in the country or the region that we are talking about. And obviously, IHE will play and has to play a huge role in this process. The vision for the Standards and Interoperability Lab is to become a conformity assessment center for maybe first the ASEAN region, but hopefully also for Asia Pacific, and to create more of these assessment centers in the countries. The lab is modeled after the Mohawk College and the HIE lab. And the ADB invested in it last year, so it's still a small room, growing, but please, if you're interested to learn more, approach Dr. Fazila or Dr. Bunchai later, or me, and we need all help available and possible to grow this into a center of excellence. Currently, it is affiliated with the Philippine General Hospital and the University of the Philippines. What it does is, first, it brings together different teams. So we have projects with public hospitals, with the Ministry of Health. And for example, the Philippine General Hospital still has, for each department, different information systems. So you can't, right now, you can't transfer your radiology result from one department to the other. So this is one of the first smaller solutions we are looking at. And again, I want to remind you, the Philippines is non-standard based. Okay, so we are trying to fix this. The other one is training, because what we also see is that there is a lack of health informatic expertise in our region. So we are also now developing the first health informatics curriculum at the University of the Philippines. And we know that this is, happening in many countries. So we want to support this. The third one is tooling, and there it's really about creating the standard-based interoperability profiles. And interesting there is really also what we see is another paradigm shift. In many developing countries, we saw that everyone thinks, and development partners think, it has to be open source and free. And maybe that's not always the best solution, and maybe that's not always sustainable. So this brings us back to the issue of sustainability, where we need a guided process. And the last one is really testing, and we heard that before. This is about hackathons, bringing different partners together, and testing solutions. So now I'd like to talk about the third paradigm shift, and as a converted banker, this is my favorite one, and this is investments. How do we convince ministries of health to invest in digital health infrastructure, in the soft and in the hard parts of infrastructure? This means really the data highways, but this also means the soft parts like the standards, the curriculum, creating a thriving local health IT industry. What is required for that? So the difficult thing there seems to be that everyone believes that what we pay for has to be monetized again. But I think the important thing in healthcare really is that it's about the value, and the value you give to life and you give to the patient. And that's another paradigm shift we still have to see in the Asia-Pacific region. But if you look at a few points here, and how can we build this investment case, and we are currently doing that together with the Asia e-Health Information Network. It's about how to improve better health services, better quality, how to improve population's health, how to create more efficient workflows, and how to reduce service wastage. In developed or more developed or richer countries, it's really about saving healthcare costs. In developing countries, I believe we can't speak about saving yet. We have to look at improving coverage, improving access, and improving the quality of care. So I think the quote, price is what you pay and value is what you get, is very right for this region here. So we have to create a value-based healthcare system, and for that you need standards and improve the quality of care. So for ADB, the role is really to also look at the big infrastructure. And I want to give you an example. In the Pacific, we are investing in submarine cables to improve connectivity, for example, in Samoa. And there we were able to convince the government to link it to a digital health project. So now we are building the health information exchange in Samoa linked to this hard infrastructure. And that was a leverage point for us, how we were able to convince the government to invest in digital health. The same is now happening in Tonga. And hopefully other countries will follow, where we see a more, we're saying like volume-wise, bigger investments in health. So I like this slide a lot because this is also how I was able to convince our management to see digital health as a business line for ADB. It's really about the data highway, and we have to look at health IT as a highway, as infrastructure that needs to be built with all the associated software components. I'd like to summarize now what I said in this slide on emerging issues for investments in sustainability, and that was the topic of the talk, investments and sustainability and the role of HIE. So if you look at the problems currently in the region, it's really about lack of vision, a bit weak capacity, still kind of weak digital literacy if we look at the general population in developing countries, and at the same time we see this very rapid demographic change. But we also see trends, and these trends are more curriculum in health informatics. Many countries want to do telemedicine but don't really have standards, don't know how to transmit information or patient data or images. They understand a bit more about standards, but again, more has to happen. And if you look at the emerging issues for this region, we really need to realize that the countries are leapfrogging now. They don't have legacy systems, so they have a great opportunity to build new systems, to provide personalized care, continuum of care, and to drive standards-based care. And what we need for that is the money, the funding, and a good investment case. We need IHE to guide that process, to provide standards which are kind of the best of the rest standards, or whatever you want to call them, and to ensure that local industry and of course the international one is adhering to this in Asia Pacific. And we need more of these standards in interoperability labs, which become conformity centers for the region. And that's also hopefully how we can drive local IT industry, create more jobs, and obviously provide at the end better care for our patients. Thank you very much.